Well, as demographics change in countries around the world, more focus will have to shift to the needs of an aging population. For more insight, Diane Ty, Senior Director at the Center for the Future of Aging at the Milken Institute, joins us live from Washington, D.C. Now, Diane, let's look at dementia and Alzheimer's. The World Health Organization says more than 55 million people currently have dementia. What are the unique healthcare challenges that aging societies face when it comes to these diseases?
Yeah, so particular healthcare challenges. I think obviously when you think about Asian communities and families, we've typically the care has fallen on families. And so as you think about the increasing prevalence of dementia, so in Asia Pacific alone, by 2020 was about 37 million people, and it's projected to be about 67 million by 2050. So by the middle of the century, you're going to see that more than half of the total number of people with dementia worldwide are living in the Asia Pacific region. It's going to be a lot of taxing on the healthcare system and particular need for more community supports and services, not only for the person living with dementia, but also the family caregivers.
I want to pick up on that because the burden of caregiving is manifold. There is financial strain, it's time consuming, and some family caregivers also have to leave the workforce just to take care of their loved ones. So what are the consequences of this, and how can government support caregivers in a meaningful way?
That's absolutely right. We're seeing that too here in the US, and I imagine in Asia, about 2/3 of caregivers are women. And in Asia too, we're seeing more women leaving the workforce to take care of their family members. And in terms of supports that are needed, we need to ensure that there's paid family care leave. We need respite care for those caregivers. We need more in-home supports and care systems. And then just overall more places like adult day services that your aging loved ones can go to during the day so that you can work.
Diane, these diseases place a significant burden on healthcare systems. What to you are the best examples of policy-making strategies that have proven to be effective in addressing these challenges, for example, maybe in Japan?
Yeah, so we're looking, one of the most effective things we can do is really improve early detection of dementia. We know that, globally, we estimate 60 to 80% of dementia is being undetected, undiagnosed. So in Japan, a more concerted effort to really look at cognitive impairment among older adults and checking for that, and making that part of just your routine healthcare checkup, not unlike taking your blood pressure or doing a mammogram. Brain health screenings are really what's important from a health system perspective.
And the economic impact as well,
Diane,
of dementia and Alzheimer's is substantial. So if a country doesn't have deep pockets, how is it possible to still craft effective policy with or without tapping support from external bodies?
Yeah, I think that's a challenge for most governments and countries. A lot of that care is really falling on the families. And we also know that there's a lot you can do to actually prevent Alzheimer's and dementia in the first place. So really focusing on preventive care, things like sleep, nutrition, exercise, not smoking, reducing incidence of hypertension, type 2 diabetes, obesity. We are seeing in Asia actually an increase in non-communicable diseases happening at a younger onset by the impact of some of our diets. And so we really do need to focus on prevention. We know that there are 12 modifiable risk factors that, if really looked at seriously and focused on, could reduce up to 40% of dementia. So a real focus on prevention in the first place, and then once it is diagnosed, having those systems and supports in place to help those family caregivers.
And Diane, one last question. As we see more promising advancements in medical research and treatment options, how can policymakers and healthcare providers facilitate the translation of these advancements into practical and accessible solutions?
Yeah, so I think it's really exciting. Last week, the Federal Drug Administration in the U.S., the FDA, approved full approval for Leqembi, a monoclonal antibody that really attacks the amyloid buildup in the brain. So being able to really diagnose early, because it is available for and most effective for people with mild cognitive impairment and early stage Alzheimer's disease. So that early detection is really necessary to be able to make some of these drugs available to the people who are most apt to benefit for that. And then really to just continue increasing the scientific support and research. We know there's so many exciting drug therapies in the pipeline that we'll be seeing over the next several years that hopefully will not only slow down, but eventually cure this disease.
Oh, Diane, thank you very much for your insights. That was Diane Ty, Senior Director at the Center for the Future of Aging at the Milken Institute in Washington, D.C.